enveloped Indian cinema.
Union Cabinet clears ordinance to slash salaries of MPs by 30% for a year. MP-led funds of 7,900 crore rupees to be suspended for 2 years. Funds to be used to bolster war against coronavirus. President, Vice President and governors also volunteer similar pay cut. Prime Minister Narendra Modi holds video meet with Council of Ministers, asks them to work on a plan for graded opening of departments where hotspots aren't existing. PM stresses on ensuring reach of Garib Kalyan Yojana, popularizing Arogya Setu app in rural areas. Government lifts restrictions on export of select COVID-19 related pharma products. MEA says decision taken only after confirming availability of medicines for all possible contingencies. Paracetamol and hydrochloroquine to remain in license category and continuous monitoring. Number of active corona cases in India reaches 3,981, while 325 persons have recovered and been discharged. 114 deaths reported. Confirmed COVID-19 cases across the globe crosses 13 lakhs with over 74,000 fatalities. Japan likely to announce coronavirus emergency and launch $1 trillion stimulus package. UK PM Boris Johnson in ICU as his symptoms worsen. WHO says lockdowns are proving effective in many places, says lifting of restrictions require database calibrated approach. New COVID-19 deaths register a fall in number in Spain. Number of new cases fall in Italy. South Korea reports less than 50 new cases. Welcome to this bulletin. I'm Shubhendu Ghosh. Among the major cabinet decisions announced on Monday, a 30% deduction in parliamentarian salaries for 1 year has been announced. An ordinance amending salary, allowances and pension of MPs Act has been approved. And President, Vice President and governors have also decided to take a pay cut as a social responsibility. All the money and funds saved is being redirected towards fighting COVID-19 and will go to the Consolidated Fund of India. Another important decision taken is that MP-led funds will remain temporarily suspended for a period of 2 years. And Prime Minister Narendra Modi held a meeting with Council of Ministers through video conferencing, where he asked them to take substantive steps during and in the aftermath of the coronavirus pandemic-induced lockdown. PM has asked all ministers to come up with a graded plan to slowly open departments in areas that have not emerged as hotspots of COVID-19 pandemic. PM further urged ministers concerned to continuously monitor and ensure that Garib Kalyan Yojana benefits keep reaching the intended beneficiaries in a seamless manner. He also asked ministers to popularize the Arogya Setu app in rural areas and grassroots institutions to further spread information and awareness about the pandemic. Thinking ahead, Prime Minister urged ministers to think beyond the lockdown. In the interaction, Prime Minister said that essential it is to strategize for emergent conditions once lockdown ends. He asked for preparation of a list of 10 major decisions and 10 priority areas of focus once lockdown ends. Identify and implement pending reforms in various ministries and departments to maintain objective index on how their work will promote Make in India. Also, how the country needs to lessen its dependence on other nations, prepare business continuity plan to mitigate impact of outbreak on the economy. the impact that coronavirus outbreak has had on the economy. Also, greater plan to slowly open departments where hotspots aren't existing. That plan should be made. Crisis offers opportunity, he said, for the country to become self-dependent in medical sector in particular. He also asked the ministers to submit actionable suggestions and on boosting manufacturing and exports in the country, and also ensure that new sectors and countries are added to India's export net. And Prime Minister also asked the ministers to remain in touch with state and district administrations to provide solutions to emergent problems, come up with district-level micro plans, continuously monitor, ensure that Garib Kalyan Yojana reaches the beneficiaries that it is intended for. Besides, PM urged the ministers to explore use of innovative solutions to ensure welfare of farmers, use of truck aggregators on the lines in which we have cab aggregators in urban spaces, popularize the use of Arogya Setu app in rural areas and grassroots institutions. And Prime Minister Modi has wished well for all on World Health Day. In a tweet message, he said, "Today on World Health Day, let us not only pray for each other's good health and well-being, but also reaffirm our gratitude towards all those doctors, nurses, medical staff and healthcare workers who are bravely leading the battle against COVID-19 menace. This World Health Day, let us also ensure we follow practices like social distancing, which will protect our own lives as well as lives of others. May this day also inspire us towards focusing on personal fitness through the year, which would help improve our overall health." Now, India will license paracetamol and hydroxychloroquine in appropriate quantities to all neighbouring countries who are dependent on India's capabilities. Responding to media queries, External Affairs Ministry spokesperson Anurag Srivastava today said, decision has been taken in view of humanitarian aspects of COVID-19 pandemic. He said India will also be supplying these essential drugs to some nations who have been particularly badly affected by the pandemic. He added there should not be any speculation or attempt to politicize the matter. MEA spokesperson said that DGFT has notified lifting restrictions on 14 drugs yesterday. He said paracetamol and hydroxychloroquine will be kept in a licensed category and their demand position would be continuously monitored. He assured that the first obligation is to ensure that there are adequate stocks of medicines for requirement for India's own people. In order to ensure that, some temporary steps have been taken to restrict exports of number of pharmaceutical products. Srivastava also said these restrictions have been largely lifted after having confirmed the availability of medicines for all possible contingencies currently envisaged in the country. And let us look at the total number of active COVID-19 cases. It stands at 3,981. Of the number of people cured and discharged, the number stands at 325, and the total casualties, deaths in India so far due to coronavirus stands at 114. Total number of cases in India stands at 4,421, of which, as we mentioned, 325 people have been discharged. They've recovered fully. So far, there have been 114 casualties. 63% of the deaths reported in people aged 60 years and above, so mostly senior citizens. 1,445 cases so far are related to Tablighi Jamaat congregation. Meanwhile, Centre on Monday released an additional fund of Rs 3,000 crores to states to fight COVID-19. Spokesperson of the Health Ministry, Love Agarwal, said the government had already released 1,100 crores from National Health Mission funds to the states for procurement of personal protective equipment, PPE, and food items. And amid the increase in number of COVID-19 cases in Uttar Pradesh's Meerut, a sanitisation cabin has been installed outside the office of Meerut Cantonment Board. A bottle of hand sanitizer has been kept in the cabin so that every individual passing through the cabin sanitizes their hand and can stop and also bring an end to the spread of COVID-19. And thousands of food packets are prepared and served to the needy people every day by district administration in Coimbatore. Many social activists are also engaged in serving food to the needy people. All volunteers have been instructed to wear face masks and gloves along with frequent usage of hand sanitizers while distributing as well as preparing food in the kitchen.
We have been established community kitchen in Coimbatore Taluk office to provide food for the needy peoples who are affected by the curfew imposed by the government. Normally, daily we are planning to distribute around 1,000 food packets to the needy peoples. Yesterday only we have started the community kitchen. From yesterday up to 16th April, we are planning to run the community kitchen with the support of our Coimbatore Taluk staff and volunteers from different walks of life.
In Agartala, a tailoring skill development center has turned into mask production unit to overcome the shortage for medical staff, including doctors, nurses, caregivers and caretakers. It's important to follow the safety norms of wearing masks, gloves and sanitizers. It is also important for patients, family members attending to the patients and those visiting hospitals to wear masks. Due to the lockdown and stopping of trade between India and Bangladesh, large number of truck drivers are held up at the Indo-Bangladesh border in and around ICP Petrapol. 179th Battalion along with an NGO distributed ration among truck drivers and helpers to the needy laborers. Each person was given ration for 10 days. Ration was distributed taking all precautionary measures, maintaining social distancing to avoid spread of COVID-19 virus. Besides, the food was prepared and distributed among 50 poor and homeless people at ICP Petrapol. Now, in these testing times, it is important that we stay away from any fake news circulating on the internet or social media. In order to stop the spread of fake news, Ministry of Home Affairs has urged people to use or share information from verified credible sources only. For any government policies or scheme, they should refer to Press Information Bureau (PIB) Twitter. It said spreading of fake news is a punishable offence by law. Therefore, if people come across any fake news on social media platforms, they should report it to www.cybercrime.gov.in. Also, the nation has been responding positively to Prime Minister's call to donate to PM CARES Fund to help tide over COVID-19 crisis. However, some antisocial elements have been trying to misappropriate the forum by creating fake UPI IDs trying to dupe people. It has been informed that the only correct UPI ID for donating to PM CARES Fund is pmcares@SBI. All other similar looking IDs, the ones that you can see on the screens, are fake, and the people are advised to be aware of such fake UPI IDs. And further rubbishing the reports being circulated on WhatsApp, claiming that police can take action against group admins if there are jokes posted on coronavirus. Press Information Bureau in its Twitter account has informed that there has been no such advisory or order issued by the government. Another fake news doing rounds is that Indian Embassy in Brazil is collecting information of Indians stuck in Brazil. Press Information Bureau again stated that these are absolutely false claims and there is no truth to this news. The Indian Army will take over the COVID quarantine facility at Narela gradually. It is clarified that consequent to the request to take over the medical screening set up at Narela camp, additional Army medical staff is currently working along with civil medical professionals as part of the process of taking over screening duties. In the interest of smooth running of the facility, it is being ensured that the takeover process will be gradual. Some international news. First up, in the UK, Prime Minister Boris Johnson has been moved to intensive care unit in the hospital after his coronavirus symptoms worsened. Amidst this care, PM Johnson has asked Foreign Secretary Dominic Raab to deputise where necessary in the fight against coronavirus. Johnson was admitted to hospital on Sunday night and had been undergoing tests after suffering persistent coronavirus symptoms, including a high temperature, for more than 10 days. However, he has not been put on ventilator. US President Donald Trump said Americans are all praying for his recovery. And good wishes from India as well. Prime Minister Narendra Modi has wished speedy recovery for UK Prime Minister Boris Johnson. In a tweet message, Prime Minister said, "Hang in there, Prime Minister Boris Johnson. Hope to see you out of hospital and in perfect health very soon." Spring has arrived in Britain, but the lockdown due to the spread of pandemic COVID-19 has crippled Britons inside of their homes. The gardeners have found a way to ensure that people witness the beauty of the 174-year-old Cambridge University Botanical Garden through Wellness Wanderers, which are short videos showcasing more than 8,000 species of blossoming flowers. Meanwhile, in other parts of Europe, even if recent numbers show a decline in number of deaths, Italy is still one of the countries worst affected by the new coronavirus, accounting for almost a quarter of the worldwide casualties. Some 129,000 people have been infected in the country since the outbreak was discovered on February 21st. Around 16,000 of them have died. The second most affected country in Europe is Spain, that has reported over 4,000 new cases of coronavirus with over 600 new deaths. The daily totals, however, continue to remain on decline mode. The total number of deaths in Spain from COVID-19 yesterday passed the 13,000 mark among more than 135,000 cases. On the positive side, a total of 40,000 people have recovered from COVID-19. They've been discharged from hospital and are healthy. Prime Minister Pedro Sanchez said weekend the lockdown would remain in place until April 26th. In France, the number of people who died from coronavirus infections increased by 10% in a day to a cumulative total of 6,494 yesterday. However, fewer new cases are being reported, even though the rate of death has speeded up again after several days of slowing down. French people continue to be advised to keep respecting confinement directives currently in place. And our international correspondent Lucy Howe has more updates from Europe in Brussels.
There are more signs of hope from Spain as it enters its fourth week of lockdown. A continued decline in the number of new cases and deaths. The death toll is down from 809 on Saturday to 637 on Monday. Spanish Prime Minister Pedro Sanchez said over the weekend that relaxing the lockdown measures is not yet an option. The next phase will be testing everyone with symptoms and studying the effectiveness of wearing face masks in public. There are also signs of improvement in Italy, which has reported the lowest death toll in over 2 weeks. Authorities there saying the country is now past the peak of the epidemic, but is warning of a difficult few months ahead. The lockdown measures in place are likely to be extended into May. Austria is becoming the first European country to announce plans to begin the transition back to normal life, allowing some non-essential shops to reopen next week after the Easter weekend. Meanwhile, here in Brussels, finance ministers from the Eurogroup are meeting via teleconference on Tuesday, with the EU's emergency bailout fund, the ESM, likely to be used to extend credit lines to badly hit countries like Italy and Spain to mitigate the economic damage of the coronavirus. Lucy Hoff, DoorDash News, Brussels.
A Greek pastry chef in the northern city of Thessaloniki created chocolate bunnies wearing face masks and gloves, as well as needles representing vaccines and coronavirus cells made from chocolate and icing for the Easter holiday. The country has so far reported 73 casualties, 1,735 coronavirus cases. And 7-year-old pianist and composer, again from Greece, has created a score to boost the enthusiasm of those suffering from COVID-19. Stelios Kerasidis, the child prodigy who learned piano at the age of 2, has composed a song titled Isolation Waltz with his father, who also teaches him piano. Stelios dedicated his piece of art to coronavirus patients across the world. great spirit in testing times. Moving on, Japan's Prime Minister Shinzo Abe on Monday proposed a state of emergency for several major regions, seeing a sharp rise in coronavirus cases, as well as a stimulus package worth $1 trillion to cushion the impact on the world's third biggest economy. The official declaration of the state of emergency would likely be made today. Abe told reporters in Tokyo as the country grapples with the recent spike in coronavirus cases, especially in capital Tokyo.
Since there are already critical situations happening at medical facilities, we are advised by the advisory committee that we, the government, should prepare for the declaration of a state of emergency. The duration will be about 1 month. We need further cooperation from citizens to minimize contact between people, which can lead to infections. And we need to prepare well the medical system. The state of emergency will be declared for these reasons.
In Nairobi, police have begun stepping up the roadblocks after President Uhuru Kenyatta barred movement into and out of Kenya's 4 most affected regions affected by the coronavirus. The orders ramping up restrictions are for 21 days and also include the port city of Mombasa and the counties of Kilifi, Kwale. Kenya has so far reported 158 coronavirus cases and 6 deaths. Now, amidst the COVID-19 scare, World Health Organization has raised concern that wearing of medical masks for general public could exacerbate the shortage for health workers on the front lines of COVID-19 pandemic. WHO Director General said, first and foremost, medical masks must be prioritized for health workers. In a virtual briefing, Tedros added that masks alone cannot stop the spread of the pandemic. Countries must stick to finding, isolating and treating every case and its contact. Lauding the lockdowns across the world as an effective tool in dampening the spread of coronavirus, WHO had stressed that any lifting of restriction requires calibrated, stepwise approach based on data. The WHO head also said that organization by the end of the week will make major initiatives to accelerate research, development, production of vaccine for COVID-19. Meanwhile, today is World Health Day that marks the foundation of WHO. WHO on the occasion tweeted and said, "Today we celebrate the work of nurses and midwives by showing our appreciation for their bravery, courage and resolve in global COVID-19 response." And back home, Raksha Mantri Rajnath Singh chaired a group of ministers meeting to devise a strategy to counter COVID-19 induced lockdown in the country. Home Minister Amit Shah, Minister for Information and Broadcasting Prakash Javadekar and others are also present in the meeting. Meanwhile, Ministry of Health and Family Welfare has released a video message to knock down the psychological stress among the countrymen due to virus-induced lockdown in the country. Take a look at the message. So in these testing times, stay calm, take care of yourself and your loved ones while maintaining social distancing. We're all together in this. Namaskar.